Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about remote medical coding, what you should know. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, one of the hugest selling points for medical billing and coding programs is the phrase, you can do this from home. When it comes to working at home doing medical billing and coding, there's a lot that goes into it. Because what we have in our possession is a few things, a few very important things. We have people's personal, private health information at our disposal when we are accessing their medical record. Not only that, we have equipment that is oftentimes provided by the company. Most places that I have seen that are remote medical companies, medical coding companies, they will send the person that's working equipment so that all the patient's private information will only be accessed through their computer, which is very good because it's going to keep the problem of hacking to a minimum, hopefully. When you are working from home, you do have to have a secure internet connection. You cannot just be connecting to Wi-Fi going out willy-nilly, okay? This is why when people ask me, well, can I travel around doing medical billing and coding? I want to buy an RV and do medical coding on the road. You can't do that because then you're going to have to connect to all of these different Wi-Fi places, and then that's when you invite problems, okay? So that is out the door. If that's what you're looking to get into medical billing and coding for, you may want to think again, because it requires you to be connected to a secure internet connection, like I said. They want you in one place because you have their equipment. You have the medical coding company's equipment, and so they need to know where it is. And also, you have to be in a secure room, or it has to be in a place where no one can access your equipment. You know, when we work in facilities, anytime we leave our desk, we have to lock our computers because anybody can just roll up and just start, looking around at things that they're not supposed to. It's the same thing when you are at home. So a lot of times people get excited because they think, oh, well, I'm just at home. I can be comfortable. Yes, you can be comfortable at home. However, you do have to treat it like you are going to the office. So again, setting up your monitors in your computer that they send you, you want to make sure that your monitors are facing a wall so no one can just come up and walk up behind you and look at your screen. That way that you know for sure everything's going to be secure at all times. You will never use a printer when you are working at home because you have no business to be printing private patient information, okay? So that's just something that you have to keep in mind. When you are working at home, everything stays on the computer. And you have to make sure that when you're setting up, a lot of places will send you at least another monitor, spare monitor. When I worked at home, I always had 2 monitors. So that way, you have one for the medical record and then you have one for the data entry portion of whatever you're doing. So it does make it easier when you have multiple screens up. So it does take quite a bit of space around when you're setting up your home office. If you're going to be working at home, it does take quite a bit of space, okay? So that's just something that you have to keep in mind when you are working by yourself. If this is your first time working at home and you have no prior experience as a medical coder, it is a little bit more difficult because of the simple fact that you are going to run into questions. And while some people will say, well, there will be somebody here to help you, that's not always the case at all places. So even if you do have somebody that will be on hand to help you, just send them a message, you're still taking that person away from their work, and they want you to be able to try to problem solve and do these things on your own. So you really do have to be a problem solver when you are working at home for the first time, because guaranteed you will run into a question. And if you keep running back and forth to your lead medical coder or your supervisor, they're going to get tired of this, right? Let's just be honest. And if you are not attempting to look up the answer on your own and you're just wanting the answer to be given to you, again, you're not going to make friends that way, okay? So You have to learn how to problem solve. You have to learn how to use the power of the internet. Use Google, look at your coding guidelines. Look at the Merck manual. The Merck manual is a book that houses a lot of different disease processes, and it talks about the symptoms, it talks about the treatments. There's a lot of really good information that comes out of using a tool like the Merck manual to help you to understand what you're reading. There's also description books for different procedures. I do have those things that I do recommend in the description box below. I've talked about them previously. You can find them at Optum360 Coding. There's a website for Optum360 Coding, and they have, this is not an ad, but they do have all of these books that I do trust, and they have different coding companions. They're called coding companions based on different specialties, and it will give you like a whole list of like all the procedures that fall into that specialty and all the diagnoses that go with those procedures, and just different descriptions of these procedures, what the RVU counts are. So this is a very valuable resource if you are going to be working by yourself and you need to have those different materials to help you to understand, because again, it's about being a problem solver. This is why before the pandemic, if you did not have 3 to 5 years of experience, you were not going to be working at home, because they want to make sure that people who are working at home truly do understand what they're doing when they're walking in, so that they don't have to be trained. But the pandemic changed things. So while some people are still able to find work at home, I still do not recommend it if you are brand new. And I know that's going to upset some people, and that's okay, because I'm not here to say everything that's going to make you happy, okay? I'm here to set you up for success. And there's some people who get hired on to work remotely, but they're trained in a facility for a little while, so they have time to ask questions about the electronic medical record that they're going to be using, and they have time to get comfortable with the clinic that they're going to be in and that kind of thing. So that is okay. If you have that opportunity to get that time in, to have that one-on-one time before you get sent home, that is going to set you up for success. But again, if you are doing remote medical coding because you want to be able to run out and go do errands during the day and just come back and I'll just leave my computer on, when you are in your computer, every single record that you touch will have a time stamp, and however long you stay in that record, anything that you do, it will all be tracked. If you are looking at different lab reports, if you're looking at x-rays, if you're looking at different notes and things like that, every single thing that you do will be tracked, okay? And so if they notice that you're taking a long time, they may run an audit report to see, what is it that you're looking at? What are you doing while you're in this record? And if you are working on something that is easy and it took you a really long time to do it, that's when they start to question you. Why are you taking so long? So just keep in mind that they have things that they can do to monitor you when you are working remotely. So if you think that you can just go and tend to the kids and, put in a load of laundry, that's just not conducive to a good work environment. So again, you have to treat it like you are in the office, and working remotely, it's going to show, right? What you're doing when you're not at your desk, okay? Even though you may not have a camera on you at all times, you're still being electronically tracked based on the time that you spend in that record. Okay, so that's just something that you have to keep in mind. Working remotely is great if you know what you're doing. If you know what you're doing already, and perhaps you just like the solitude of working by yourself, and you don't have those coworkers coming in and out, or maybe you worked in a situation where you were always around coworkers and there was like a lot of drama. So working at home is great. Working at home, again, it can be great, but you still do not miss out on that drama. A few years ago when I worked for a level 1 trauma hospital remotely, there was still drama, okay? And you could still sense tension between coworkers, even just on Messenger, All right, so that's something that you got to be aware of. It doesn't escape you if you are working remotely. And a lot of times, because we have written communication, that takes a lot of the inflection out in your voice. And a lot of people say, well, I don't write very well, so what I wanted to say didn't come across right. And that's another problem. So if you aren't really stellar at writing and you tend to, kind of trip over your words as far as like what you want to say, and you don't express yourself clearly in writing, that could be an issue. All right. Another thing that is really kind of bad with remote medical coding is that you miss out on building those relationships with your providers. I talk about this quite a bit on my channel because it is very important. And a lot of people are trying to get away from that. There's a lot of people who think that working at home is so great because you don't have to deal with the doctors. The doctors need us, guys. They need us. They need us to be there to kind of guide them. They will not seek the medical coders out a lot of the times. Like 90% of the time, they will not seek medical coders assistance. They think they've got it all figured out because their buddy said this or somebody said that, or they talked to a nurse and the nurse said to do it this way, when in actuality, they should be talking to the medical coders because the medical coders are supposed to be the ones that know. And so again, if you don't have those relationships with those providers, and you are only showing up as a presence on email, they can easily ignore that email. Easily, quite easily. And again, if you are not very sure of yourself and you're writing out things like, I'm sorry to disturb you, I do have a question about this, immediately these providers can say, oh, this person is showing weakness because they're apologizing for something that they don't need to apologize for. So that's something that we have to work on, folks. When you are immediately apologizing for nothing, every single one of your words means something. And if you are immediately apologizing in email because you think it's going to make you look demure and it's going to make you look friendly and sweet, and maybe they'll answer you this way, if you don't sound mean, it's not about sounding mean. It's about being concise and to the point. That is the whole purpose. Because if you are writing them a whole long email trying to get your point across, when it would have been just as easy just to go in person, right, to talk to them. But if you're writing a whole big old email and you're having all kinds of this all over the place language and they don't understand, again, it's just as easy for them to ignore you. So that's why it's very good if you are in the facility. But if not, and you're just working remotely, just keep in mind that building relationships with providers is 10 times harder than it would be if you're in person and you see them face to face. Okay. I've been told before it's really hard for them to ignore you if you're in person. And it's hard for them to not want to get to know you if you are there. All right. So that's just something that you should know. Remote medical coding gets lonely. Even if you are not a social person, I am typically by myself. And if I am around people, I'm okay. I'm not socially awkward or any of those things. But for some people, they like to be alone, but they still like to have social interaction. And you'll notice this after a while when you get by yourself. And if you're by yourself all the time, it does sort of wear on you mentally, right? You want to make sure that you are taking care of yourself, your mind and your body, because being alone all the time, even if you are with your family, you miss out on those coworker relationships. You miss out on actually being around other adults if you're just constantly with your children. And that can really take a toll on people sometimes. All right. So that's just something to just watch out for, because while you may think, oh no, I don't want to be in an office setting anymore. Every place is going to be different. And, working alone by yourself, that's just something that you have to really take everything into consideration. The first time that I worked remotely and I was working by myself, I was totally fine because I already had a social network already built. And so I was constantly having, adult interactions and everything. So I was fine, right? Of course, when the pandemic hit and they sent us all home and I was home for 5 miserable months, it was misery for me because I had just gotten so used to constantly being around people. And then you take to the fact that we have this horrible pandemic going on. There's fear everywhere, and everybody's kind of worried, and you're at home constantly. And it was just too much for me. It was too much. I will never work at home if I can absolutely help it when it comes to medical coding, because my providers suffered. They did not get a chance to go home because they have to be at the facility. And so they were there every bit, and they had to practice all the precautions and everything. I was constantly getting emails, Blue, when are you coming back to the facility? And I was like, I'm coming back whenever they say we could come back. And then, of course, I had issues with my internet at the house, and I had to go back. So I definitely was very happy going back. And, again, it's just a matter of perspective and where you are. I missed being around them. It is difficult when you go from chaos of the office to really quiet of the house. And again, if this is your first time working remotely, going to the quiet of your home and just trying to concentrate and pay attention to this, it's different. All right. And I really want you to think about that. Some people say it's the best thing, and some people agree. They're like, Blue, yeah, if I would have known it was like this, I definitely would have made sure that I worked at a place first. And I'm just telling you guys this because I want you to be aware it's not all rosy, all right? Not everything that glitters is gold. And the idea of working at home is very tempting for a lot of people because sometimes they live out in rural areas. Sometimes it's just a commute thing that, they don't want to be in the vehicle that long, or, whatever the case may be. But if you are working at home and you're treating it like you're going to the office, meaning that you're getting up, you're getting dressed, you're, taking care of yourself, and then you're getting into that mindset of work, you do your work for the day. You're not sitting here trying to run out the door and do errands and, just work whenever you want to. And that's another thing. A lot of places, people will ask me, can I work whatever hours I want to if I'm working in at home? Absolutely not. I don't know every employer in the world, but I do know that the majority of even remote medical coding companies will have the people working at certain times. And so if you are working in a different, if the headquarters is in a different state than you, they're going to want you to be on that time zone time. So if you are, working on the Pacific Coast and your company is central based, and they're going to expect you to be there at 7 o'clock Central Standard Time, that means at 5 a.m. you're going to need to be, clocked in and doing your thing, because that's when they are there. And sometimes they want you to be there because they want you to be available for meetings. They want you to be available, like basically on call for questions and things like that, if nobody else is doing that in that place. Some places will have one designated person as the coding educator. And while that can be good, it can also be bad depending on the coder's knowledge base. Sometimes coders are more knowledgeable than others, and some are like really experienced, whereas others have like a lot of education but not a lot of experience. So that can play a big role in understanding actually what's happening in this record, and being that liaison between coder and provider. So if that is not the case at your facility and you have to be responsible for it, they want you to be available when the provider is going to need you. All right. So again, it's a lot of responsibility when you work from home. They expect you to be a self-starter. They expect you to know what your tasks are as far as like what you have to do on a daily basis. And they expect you to be able to do this without prompting. And if you are not somebody who can do that, if you are somebody that needs that constant, somebody to tell you what to do, again, you may want to rethink working from home medical coding. All right. There's a ton of other things that you can do working remotely. And this one doesn't necessarily have to be one of them. All right. Because this is a very serious field. I often say we have to know what doctors know while never having gone to medical school. The productivity standards are going to be higher because they're going to expect you to have no distractions. The accuracy standards are going to be high as well because, again, if you are working from home, it means you've had experience or that you know enough that you can figure the answer out on your own. And again, that's going to be reflected in their accuracy expectations. Now, accuracy expectations can vary from place to place, but they're generally high when you are working remotely. I've seen them as high as 97%, and that's what my facility currently is at, is 97%, and that's fairly high. That means that you are not making any errors, and that's always the goal, you know. But again, if you are wanting to seek remote work, look at these facilities and see if they have remote work. Sometimes they do like a hybrid schedule where you're there some days of the week and then some days of the week you're at home. And if that's the case, that's okay. I mean, that at least you're balancing out getting some social interaction and still being there, still being a presence for your providers so that they have access to you in case they do have questions or in case you want to make that effort and start building those relationships. Because understanding who the provider is so that you can understand what they're writing and you can see how their thought process goes makes a world of difference when you are coding. All right. And I've learned that. That's one of the things that I learned is you learn a lot about the way that they document when you know them personally versus not knowing them at all. I'm just saying. So if you are out there, good luck. If you are searching for that remote coding job, but just keep in mind, it's a lot of responsibility, guys. It is a lot of responsibility. But again, I wish you the best of luck on your journey. If this video helped you, I hope you will like, subscribe, and share, and I'll see y'all next time. Bye.